Seaview Orthopaedics for this wonderful opportunity to talk about concussions. So we have a lot to cover in a little bit of time, but with that being said, we've all heard the word concussion before. We all have watched ESPN in the news. We know that it's a thing, but I want to try to kind of uncover and talk a little bit more about the fundamentals of what a concussion is. This way we have a better understanding of what a concussion is, and then also how we treat it and what all that means. So moving right along. So this presentation is for literally anybody. So athletes, parents, coaches, trainers, athletic trainers, physical therapists, occupational therapists, and anyone who is interested in and wants to learn about concussions. So what is a concussion? Let's start out with the most detailed definition that we have. So a sports-related concussion, also known as an SRC, is a traumatic brain injury caused by a direct blow to the head, the neck, or the body, resulting in an impulsive force being transmitted to the brain that occurs in sports and exercise-related activities. That's a definition that has pretty much been published in the summer of 2023 after the International Committee on Concussion met for the 6th time. So this is from, this is like the most recent updated definition that we have. And what we know about a concussion, and more so over the past couple of years, is that a concussion doesn't show any anatomical changes in the brain. It's damage down at the neurochemical and the metabolic pathways that are really what cause all of the symptoms that we see in concussion. It's one of the most common head injuries, especially in athletes, and the symptoms of concussion range from loss of consciousness, headache, abnormal blurred vision, disorientation, balance abnormalities, nausea, vomiting, and many, many more that we're going to discuss later on in this presentation. So one thing I like to drive home when talking about concussion, because concussion is such a serious matter, especially in athletes, is that concussion falls on the spectrum of traumatic brain injury. Traumatic brain injury, you have mild, moderate, severe. At the severe end of traumatic brain injury, these are people who have been in really bad accidents, have a lot of traumatic things that happen to their body, and then especially injuries to their brain. At the other end of it is the mild traumatic brain injury. Here is where we have concussion. The thing that makes a concussion and not necessarily a moderate traumatic brain injury, in addition to a couple other factors, is that you can't see any changes to the brain on routine MRI or CT scan. That's one of the #1 things. So when you are being treated for a concussion, or if you go to the emergency room for a concussion, they might not necessarily do an MRI or a CT scan. Why? Because there's no need for it. It's not going to tell us anything different than what we already know. So to understand more about a concussion, let's understand more about the brain. So the brain here, this is what we know the brain to be, right? We've seen it on cartoons, we've seen it in school, we've seen it all over the place. But what we know about the brain is it's as organized as this mess of wires, right? It's just a whole bunch of neurons that come into one location and do a whole bunch of random and sophisticated things that control our day-to-day activities and our thought processes. It's been said by scientists that we know almost as much about outer space as we do about the workings of our brain. And, you know, we know that we don't know a lot about outer space, right? So we really don't know that much about our brain. Dive a little deeper into it. So where's the brain? Where does it sit? So this is our head, right? We've seen these pictures before. This little yellow here, where the bone is the bone, right? That's your skull. That's the hard outer part of your head. Beneath that, you have the cerebral spinal fluid. And then just beneath that, depicted in gray in the picture on the left and in pink on the picture on the right, is the brain itself. And as you can tell, it's kind of floating around in that cerebral spinal fluid within the skull. The one thing that we have to remember about the brain is it's soft, it's pliable, it's an organ, right? So it's not hard like a bone, it's soft and squishy, more like a sponge. This next picture is not necessarily a screamous picture, but I like to give people a heads up. It's a fake skull and a fake brain, and this is a good animation because it depicts just what the nature and texture of the brain is. It's more jello-like than being like a bone and stiff and rigid. And because of this and the understanding of how the brain moves helps us understand a little bit more about concussion. So with that being said, I have to bore you a little bit with some physics talk. And it's going to be at the most fundamental level, all things that you already know from your day-to-day life. So Newton's first law of motion. We know this as inertia. An object in motion will stay in motion unless acted upon by an outside force. This is why when you're sitting in a car that's going around a turn and the car's making the turn, your body wants to go straight, so you kind of get pushed into the side of the car a little bit. It's why when a car slams on the brake, your body wants to go forward a little bit, all right? So if we apply this to the brain, knowing that the brain is just kind of sloshing around in this cerebral spinal fluid within your hard skull, if your body, your brain, your skull is moving in one direction and then it stops suddenly because of a tackle, an impact, or whatever it may be, your brain still wants to keep going forward, right? So that's where your brain hits the inside of your skull and has damage done to it. I'm going to save you from the second law of motion. We're going to jump right to the third. And this is for every action, there's an equal and opposite reaction. This is why when you bounce a ball, the ball comes back up, right? Inside the brain, inside the head, when the brain hits the front of the skull, that's called a coup injury, right? So that's the initial injury to the front of the brain. But because for every action, there's an equal and opposite reaction, that brain bounces backwards and the back of the brain hits the back of the skull. That's called a contra-coup injury. The same would be true if you were going backwards and the back of your brain was the first thing that struck the back of your skull. It's going to bounce forwards. So understanding how the brain gets injured during a tackle or whatever mechanism of injury you can think of helps us understand why we have certain symptoms of concussion, and it helps us understand how to better treat concussion. So we're done boring you. I don't know if Snoopy's had a concussion or whatever it is, but let's go on to the more fun stuff where we talk about what concussions are and how we treat them and what happens during a treatment plan. So who gets a concussion? Honestly, anyone can get a concussion. Everybody is prone to a concussion given the right circumstances. And we know in sports, boys tackle football is the poster child for concussion. It's a collision sport where people are playing pretty rough, but sometimes high stakes on the end, right? So as we kind of move down, collision sports and contact sports are what make an athlete the most prone to concussion. Other risk factors that we could talk about are if you have a history of a concussion or a head injury. We know that if you've had a concussion in the past or a head injury in the past, that you're more prone to getting a second concussion and that your healing rate might be a little bit slower, might be delayed. If you have a personal or family history of headaches or migraines, if you have any type of learning disability such as ADD, ADHD, dyslexia, various vision abnormalities, females are more likely than males to get a concussion given the same sport and rules. If you have fatigue, and that's cognitive or even muscular fatigue, makes you more prone to having a concussion, and we'll get into why in it a little bit. And then also poor conditioning and poor neck strength. And again, that's something we're going to talk about at the end of the presentation. So common symptoms of concussion. So concussion, like everything else in medicine, is on a spectrum, right? You have what happens in the minutes to hours following a concussion, and then that will develop and change over the next hours, days, weeks, and maybe even months. So the initial symptoms that we see are typically confusion and vacant stare, right? That's always what's depicted in movies, and that's kind of what we think about in our brains when somebody has a concussion. We also have sensitivity to light and noise, fatigue, maybe blurred vision, maybe a low, constant nagging headache. But we can't forget about nausea and vomiting. So nausea and vomiting are two symptoms that if you have those after you had a head injury, those are some of what we call the red flag signs, and we'll talk about what to do with those in a little bit. Your symptoms from a concussion may develop over the course of the next days, hours, and weeks, right? Hours, days, and weeks, I'm sorry. And we see them, it could be anywhere from having difficulties with your memory. You could be more irritable and have emotional changes such as increased anxiety and depression. You could feel lightheaded, have difficulty retrieving words. And one common symptom that we see is difficulty with sleep, whether it's falling asleep or staying asleep. So all of these symptoms that we talk about fall into these 6 domains of the brain, so to speak. So ocular, which is your vision, vestibular, which is your balance, cognitive, which is your memory, fatigue, your emotional, which is anxiety and mood, and then also headaches and migraines. And when you're talking to your doctor about your concussion and we're figuring out what your symptoms are, we're trying to place these into one of these or several of these categories so we can figure out what part of your brain was damaged and how we can best tailor your therapy to address these symptoms. And as you can see, there's a lot of overlap. And what we see initially is often patients kind of have a shotgun approach of the symptoms where they're distributed all over the place. But then as their concussion progresses and heals and changes over time, we can see these start to narrow down into one or two of these various domains. So talking about those red flag signs, this is the basic treatment algorithm that we try to think of on the sidelines or when we're treating you in clinic. So those red flag signs, nausea and vomiting, are two of usually like the most obvious ones where we say, go to the hospital, get checked out there. If they have to scan your head, they scan your head. The other things, obviously, if there's a visible skull deformity, if you have any kind of prolonged loss of consciousness, or seizures and convulsions, these are all things that fall into those red flag categories. And if you see somebody who's had a concussion that have some of these symptoms, it's typically a good idea to tell them to get checked out at a hospital. So what happens at the initial evaluation, right? So the initial evaluation takes place on the sideline. And that can be done by a coach, an athletic trainer, a physician, or anybody that's really trained in concussion evaluation. And there's two styles. You have short and quick, which is, and then you have thorough and long. So the short and quick one is what we call the Maddocks questions. And then the thorough and long one is the Sport Concussion Assessment Tool 6, which is called the SCET 6. And then we could talk about a tool that the layperson can use to help identify a concussion. So the Maddocks questions, right? So in the third iteration of how to treat a concussion that came out maybe 10 to 15 years ago, these Maddocks questions were developed, and they grew from 3 questions to 5 questions all the way down to 14. And you may see different iterations of it where there's like 20 or 30 questions. But these are your typical questions, like what's your name? Where are we? What's the score? All of these things. And the thing about the Maddocks questions is they're quick, so they're good to use on the sideline, but they can only be used to rule in a concussion and not necessarily rule out a concussion. So an athlete can get all of these questions correct and still have a concussion. They can get all of these questions wrong and still have a concussion. So this is a good screening tool that a doctor or a coach or a trainer can use to help kind of figure out what's going on. Now, I said that this is a more thorough and long assessment, the Sport Concussion Assessment Tool 6, right? So this comes out, so there's an international committee that meets every 3 years, and they talk about concussion, the new data on concussion, how to treat concussion, and what we now know about concussion that we didn't know in the past. And they update these assessment tools every single time. And this is the most recent one that came out in the summer of 2023, published by the British Journal of Sports Medicine. This is a QR code where you can access it. So if you want to scan that QR code now, that'll bring you to the PDF of this file. Now, this is a long and drawn out evaluation. It's very thorough. It helps figure out what domain of the brain is being most affected. But the thing to know about this is not every sideline personnel will do this, because all of your attention has to be on the athlete being treated when you're going through this. And we have to remember that there's a game going on behind us where we kind of have to pay attention to that too, because maybe somebody else will get hurt. So we typically err on the side of maybe doing the Maddocks questions as opposed to doing this. And again, this is just a tool, right? So this goes into the big clinical picture of what was the injury, who's the patient, what's happened to the patient in the past. And then all those pieces of information, along with this assessment tool, helps us figure out if you have a concussion or not. By and large, for the most part, if somebody has to go through this for you, you probably have a concussion. So we're not going to go through it, right? I just kind of put a couple up here just to show you all of the things that we go through, right? So cervical spine assessment, we check your neck, and then we start going through the various domains of the brain, right? All those categories that we were just talking about, your memory, for instance. And this is the scoring sheet at the end, all right? And in the red box down here, I highlighted that this is not a standalone method. Like I said, all of the big picture, the clinical picture comes into play. So this CRT6, this Concussion Recognition Tool 6, is on the spectrum of being newer. This is a QR code where you can access a PDF of it. And if you're somebody that is often on the sidelines, it's a good idea to have this saved in your phone because it can help you recognize a concussion early on. And this is very simple. So it's kind of like a broken down piece of the SCAT6 that a doctor might use, right? So it shows all the red flag signs. It shows, the certain instances in this box 1 where somebody may have a concussion. And then the box 2 and 3 it kind of brings into those Maddocks types questions, right? So if you're going through this and somebody doesn't really seem to be answering all these questions correctly, they may have a concussion, and it's appropriate for you to point them in the right direction to get help by either going to the hospital or going in to see a doctor as soon as possible. So what happens at that initial office visit, right? So myself and many doctors who treat concussions, we like to see our patients within the first 24 to 48 hours following. A lot of times we have Friday night football games, right? So understandably, we'll probably see you on Monday. That's fine. At that initial office evaluation, it's a longer visit than your typical doctor visit. It can take anywhere from 30 minutes up to 1 hour. And that's because we take a very detailed and thorough history of you. We incorporate some family history. It's a thorough physical exam. And depending on the physician that you go to see, the assessment's going to vary. So here at Seaview Orthopaedics, we do impact testing. And if you're not familiar with impact testing, the top QR code will bring you to their website. But impact testing is a computerized test that gives us objective data about your brain for the most part. So you answer a whole bunch of questions and it gives us a bunch of numbers. And then the next time that you come in, we give you that same exact test. And if all those numbers are improving, then good. That means that your brain is healing in those various domains that we were talking about. But if those numbers are not improving, then we know, okay, well, there's something else going on and we have to pay a little bit more attention to that particular thing. And then some doctors will use what we call the SCOT6. So it's related to the SCAT6 and it's called the Sport Concussion Office Assessment Tool 6. And this is an even longer version of that SCAT6. And it's typically how we guide our history and physical on you during that first examination. And a PDF of that is found in this bottom QR code on the bottom right of the screen. So fundamentals of the treatment plan. So the main thing that we use to treat concussion is time, okay? Time is one of the most important things that we have on our side with concussion. The things that are adjunct to time is physical therapy. Physical therapy is pretty much the foundation of most of concussion treatment plans. They can treat everything from muscle aches to your balance problems. And there's a specific type of physical therapy called vestibulocochlear rehab. At Seaview, we have a physical therapist that specializes in vestibulocochlear rehab at all of the offices. And they help you work on things that are affecting your vision, your balance, and a lot of those vague symptoms that you're having with concussion that affect your day-to-day activity. Sleep is another very important thing when dealing with a concussion, especially in the first 24 to 48 hours and kind of throughout the entire course. So the old adage of don't sleep in that first night after you have concussion because we're afraid you don't wake up, that's been debunked. That's not real. If you're worried about somebody not waking up after they've had a concussion, you should probably go and get evaluated at a hospital, okay? So the importance of sleep cannot be understated. If you're having difficulty sleeping or falling asleep, there's supplements like melatonin or magnesium that can help with that. Of course, you should talk to the doctor treating you for concussion before taking any of these supplements. Medications for headache. So headache is one of the more common symptoms that we see following concussion. So medications like Tylenol are very good, especially early on. Non-steroidal anti-inflammatory medications, also known as your NSAIDs, medications like ibuprofen. These are medications that we recommend only after the first 48 to 72 hours following a concussion because they can slightly increase your chance of bleeding. So if your concussion is more than a concussion, you're at an increased chance of bleeding in the brain. So that's why we typically like to wait 48 to 72 hours after. And research shows that after that time frame, it's more than safe to take those medications. And then magnesium. Magnesium is very good for concussions and for headaches as well. And again, before you take any of the medications or supplements, make sure you talk to your doctor treating your concussion. Ensuring that you have adequate nutrition. So a lot of what we know about concussion comes from blast victims in the military. And what research shows is that omega-3 fatty acids, like fish oil, are very good at helping neurons heal. and it's good at helping with the recovery following a concussion. So fish oil is a good supplement, and also ensuring adequate hydration. And then activity. So we're going to talk about the different kinds of activity that we recommend early on. But the return to learn protocol and return to play protocol are two of the most important things that we talk about when dealing with concussions in athletes. So I'd be remiss to not mention this. Concussion treatment is a multidisciplinary approach. So you have your primary doctor who treats your concussion, your sports medicine physician like myself. But then we also have our physical therapists, our occupational therapists, our athletic trainers, neurologists, neuropsychiatrists, psychiatrists, and then your primary medical doctor when needed. And we all can work together when treating a concussion because we all focus on those various different parts, those different domains of the brain where your symptoms might be clustered. So what's the prognosis and the recovery process looking like? It's important to set expectations following a concussion. You have to be patient. If you cut your arm and you have a scab on your arm, you know that your skin is not healed until that scab is gone and scarred over for the most part, right? Unfortunately or fortunately, we can't see what our brain looks like. So we expect our brain to heal faster, and we think that we should be healing faster because we can't see what's going on. So it's important to be patient. Being patient will take all the frustration out of this process because although we see most concussions heal in about 10 to 14 days, some take longer, and it can be frustrating, and the frustration kind of spirals into a whole bunch of other things. So be patient. So yeah, some concussions take longer to heal. If your concussion starts to hit that 30-day mark, about 1 month, then we start to think about things like post-concussive syndrome, and that's when we start to change our treatment approach a little bit more. Maybe we'll be a little bit more aggressive towards certain parts of your treatment. Maybe we'll want to get an MRI or a CT scan. Maybe we want to look for other underlying things that can be prolonging the healing of your concussion. You'll likely follow up with your doctor once a week, especially early on, and then those appointments will space out as you start to heal and progress. Okay, we like to keep a close eye on you, especially in those first couple of weeks, because symptoms change pretty drastically, and they can be, pretty alarming for a lot of patients. Most young people do extremely well following a concussion, given that it's their first concussion. And then we have to talk about a return to learn and return to play protocol, which are two of the most important things when dealing with concussion in athletes, because that's what they want to do. They want to get back to doing what they do the best and what they love doing the most. So physical activity, I want to touch on this a little bit because the old adage of, you don't want to sleep in the first night after concussion kind of falls in the same realm of you don't want to do any physical activity. You don't want to use your brain at all. That's kind of been debunked over the past 5 years or so. So we now recommend physical activity after the first 48 hours. So rest for 48 hours. Those first 2 days, take it easy. Don't do anything. Shut the TV off. Turn your phone off, just relax, all right? And then under your physician guidance and supervision, we like to start you in light activity, slowly, all right? We don't want to get you back into any kind of sport or any situation where you might hit your head again, because when we go down talking about second impact syndrome and all of that stuff. But what we know about physical activity is that, one, increases blood flow. Increasing blood flow is good for healing. Physical activity promotes healing all throughout the body, and especially in the brain. Physical activity helps you maintain your muscle tone and conditioning that you've worked so hard to build up to. It benefits your overall health, and it has mental health benefits. And this is an important part to talk about because it's become such a hot topic over the past couple of years. As athletes, we typically exercise and participate in sports for various reasons, because it's fun, but also because we may subconsciously be treating ourselves for underlying anxiety, depression, and other mood disorders. So when you take away the quote unquote medicine, exercise, that we're using to treat our underlying anxiety, depression, and mood disorders, we can start to see anxiety and depression and mood disorders kind of poke their heads and become one of the main symptoms. So early on in concussion, 48 hours in, you can go for a light walk, like a slow walk around the block. As long as you can tolerate it, it doesn't make your symptoms worse. Go for a light walk, sit on a stationary bike, and just pedal the pedals very slowly. It helps. And research is starting to show that it really does help with the recovery of a concussion. Now, talking about return to school guidelines, I talk about return to school guidelines first, as most doctors do, because we're student athletes, right? You're a student first, and part of the return to play protocol is getting back to regular activity. And as a student, regular activity involves going to school. So the first day or so, you're okay with not going to school if your symptoms are severe. There's a lot, the school environment is very stimulating. There's a cognitive load because you're trying to think. So sitting out for the first day or two is typically accepted. Following that, we'd like you to go back to school little by little. If you want to go back to school for a period or an hour and then work your way up to a half day back to school, that's totally okay. Most schools are very permitting of that. And we also give you a note to bring to school saying that you should be allowed either an excusal from quizzes and tests to postpone them until you feel better, or to allow you to have more time on quizzes and tests, as well as other assignments like homework. Once you can kind of build up that tolerance, we like to see you going back to school for a full day, typically within like 3, 4, maybe 5 days after your concussion. And during that time, if you need to take a break for 10, 15 minutes between classes or within a class and go to a quiet, dark place like the nurse's office, that's totally fine too. We're building your tolerance back up to going to school. And then the final stage of the return to school guidelines is you're back to normal. You're catching up on quizzes, tests, homework assignments, and you're able to tolerate a full day of school. Now, once you can kind of get up to this fifth part, going back to school, then we could talk about your return to play. And this often does overlap with return to learn a little bit. And I typically start my patients kind of at that stage 2, where you're walking, your stationary bike, you're getting that heart rate going just a little bit. All right. Now we move on to the next stage, or step rather, in this return to play protocol based on your symptoms. Everything is symptom driven. So if you're in stage 2 and you can go for a walk without a headache, then the next day you can go on to stage 3, which is sport-specific exercise, which could be various running drills in soccer or football, but you're not wearing pads, you're not doing any kind of contact, and you're not playing with the football or the soccer balls. If you're doing an exercise and it increases your symptoms by more than 2 points on your symptom scale, then you have to stop. The next day, you try that stage again, and if you can complete it without increasing your symptoms, then you move on to the next one. So this is progressed all the way through, right? So 3, you do those sport-specific movements. 4 is when you can start to do some more complex drills. Like, so if you're in football, you can do passing drills. If you're in soccer, you can do passing drills, but no pads. Step 5 is you go back to full practice. So you have your pads on, and then you can do all of the things that you were doing in practice as long as you can tolerate it. Step 6, which is not listed here, is return to your game. So step 5, you complete a practice. If you have a game that Friday, and you can participate in the game. So that's the return to learn, return to play protocol. And to kind of close out our concussion talk, we want to talk about how to prevent concussions, right? So we talk about targeted interventions. So as a kind of concussion community, right, we have rule changes. We've seen rule changes in football. So over the past like decade and a half, 2 decades in football, right, there's no more leading with your head. That's a penalty, right? So you have to tackle with your shoulder. I know in some leagues in New York, they don't return the ball on kickoff because you have an entire team running at full speed against somebody who's kind of standing still, and that's a big like target for a concussion to happen. Protective equipment. So the Guardian cap has become a very hot thing over the past 5 years. We see the Miami Dolphins wearing them here, the Jets wear them in their training camp. A lot of people are wearing them on the field now. They've been shown to reduce concussion a little bit, but the data is like still kind of coming out on them. And then you also have something called the Q collar, which we see the player in the top right wearing, where it actually kind of goes around your neck and it actually kind of pushes on the blood vessels a little bit to kind of help increase the blood flow to the brain. And then we have things for neck strength and conditioning. So this is a very easy one that could be done at any level of athletics. We know that neck strength, if you have increased neck strength, you can reduce your risk and incidence of concussion. And that's because your neck is like kind of the gateway to your head. And if you have a big, strong neck, you can not only be able to better control your head movement, but you can also kind of distribute the forces of a body blow a little bit better before they get up to your brain. So having a strong neck and a well-conditioned neck, and also just kind of overall general physical conditioning, can help reduce your risk of concussion at the most simple level. So food for thought. What is the athlete's long-term goal is a big question that I kind of have to bring up with parents and athletes all the time. For example, I've had athletes tell me that, you know, they aspire to be a pilot or someone that uses their brain pretty intensely. Now, if they don't want to be a college football player, or if they have no aspirations to try to make it to the NFL or whatever other big league, right? You kind of have to ask yourself, like, what's the risks and benefits? We know that concussion can have devastating circumstances. So if, you know, you don't necessarily want to be a career football player and you want to go into a profession that's kind of like your life goal, you kind of have to think about, all right, is playing football the right sport for me? You know, there's other sports that you can play that are not collision or have a lower incidence of concussion. And then the big thing that's kind of going around the ESPN community is when is it time to retire from sport? And that's another question that I have with parents and athletes and coaches all the time. It's always posed to me in what would you do if this was your son kind of situation? And that's a very tough question to answer because we all have, you know, different expectations from our life and different things that we kind of believe in and want to do. So if you're the parent of someone that plays football, or if you are the one that plays football, or if you're a coach or a trainer or whoever, it's important to kind of think about, like, how should you approach these questions? And when is it appropriate for you to kind of have this conversation with your son or the athlete or whoever it is who may be suffering from concussion or who has had concussions in the past? So those are just two questions that I want to leave off on. And now we can kind of get into some questions.
So we have a couple in the chat, but I actually have a question. So you mentioned that it's important to have like a strong neck. Do you think youth athletes are more prone to concussions because they are like smaller built and maybe haven't built up their muscle that much yet?
Yeah, so that's one of the reasons why when you are watching a football game, when we're covering football, right, and you have the freshmen who are still going through their growth spurt, and we know that when we grow, we kind of grow long, our head gets a little big, our feet are a little big, we're clumsy, we don't really have too good control of our body. That stabilization of the head isn't quite there. That's why we see like a freshman athlete is typically prone to a concussion more so than like a well-formed and developed senior football player.
All right, so we have a couple of questions in the chat. The first one is it possible to get seizures or paralysis with a concussion?
So going back to that red flag box, it is possible to have seizures and paralysis with a concussion. And typically when you have seizures associated with a concussion, it's, you know, it's kind of hard to say concussions on a spectrum of you have like very mild concussions to very severe concussions because it's hard to define. But yeah, you can have a seizure and paralysis following concussion, and that paralysis is typically temporary, and those seizures are typically temporary in that it's not something you're going to have for life. Obviously, there's exceptions, but when you have one of those two things or both of those things, those are red flags. If that's happening, you should be in an ambulance, go into a hospital, being evaluated there. And the seizures and the paralysis typically happen because when we're talking about those 6 domains of the brain, motor is kind of one of them. And that mess of neurons that was in one of my first slides, when there's a big impact to that, you know, it's the brain is more like a computer than we probably, you know, care to think about. And when you drop your computer, sometimes it gets a little jolted. It might restart. It might start working a little bit weird. There's a lot of inflammation going on in the brain. There's a lot of things that are happening. So to answer this question, yes, it is very possible to have a seizure and or paralysis following a concussion.
Are people with seizures like more likely to get concussed or no? Like not
So
well.
yeah, so what we see in the literature is for the most part, anybody with any kind of abnormality in their brain, whether it's you have a lazy eye, you have ADD or ADHD, you have migraines, you have a history of seizure, all of those things can come together and make you more prone to having a concussion. Now, if you have a seizure, right, or if you have seizures, there's a bigger conversation that you have to be having with your primary care doctor or your neurologist, whoever's treating your seizures, to figure out if playing football is safe for you.
All right, awesome. So next question we have in the chat is, you stated physical therapy is part of the treatment plan. How long would a person typically be in PT?
And that varies from person to person. So I was talking about where your symptoms cluster, all that kind of stuff. So by and large, not one concussion is the same as another person's concussion. Okay. We treat every patient differently because everybody's symptoms will be a little bit different. Some people may have more balance problems that are coming from the inner ear, whereas some people may have dizziness that's coming from the inner ear or their eyes, or their inner ear and their eyes not really working together, or they might just have muscle aches. So physical therapy for one person may be done twice a week for 2 weeks, and they might feel great and they might be back to doing their thing. Whereas other patients might be in physical therapy for months, and it's not uncommon that we see that. So to kind of it's hard to answer that question because it's on such a spectrum.
Gotcha. Next question, is there a higher occurrence for concussions based on a person's gender?
So there is. And what we mentioned in the beginning is that female athletes, given the same rules and circumstances as a male athlete, are more prone to a concussion. So, for the most part, there's not like a women's football league isn't too kind of prevalent. So when we relate this to rugby, right, there is women's rugby and male rugby. For the most part, it's the same rules, same circumstances, same all of that. Women have more concussions than males. So yes, it is more prevalent for a female to have a concussion than a male.
Wow. Tough to be a woman out here. All right, so we have a question that was texted into me. In your professional opinion, do you think Tua should stop playing for the Dolphins?
When we talk about that, when is it time to retire from a sport? I think
Mhm.
that is the definition of when it is time to retire from a sport. The amount of damage that he's done to his brain is, your brain can only function getting hurt for so long, right? Like, for example, if you break your ankle or roll your ankle rather over and over and over again, like you get pretty bad arthritis in that ankle. Now, I know you can't really relate that to the brain, but if you keep damaging your brain over and over and over again, like all of those long-term deficits that go from just like balance problems to memory to just, remembering like when your birthday is, or like being able to enjoy the moments with your family, those kind of get washed away. So to answer your question, in my professional opinion, I do think that it's probably time for Tua to retire.
I think most people would agree at this point.
Yeah.
All right, before we close out the evening, does anybody have any final questions? You can either unmute your mic or type in the chat, but I'm feeling like we're good. All right, so that is all the time we have for tonight. If you do have any unanswered questions, though, or any concerns, Dr. Scura is accepting new patients. You can book an appointment with him online at www.seaviewortho.com, or you can call us at 732-660-6200. And in case you missed my little introduction, we do host these every other month. If you go to the events page on our website or sign up for our newsletter, you will be the first to know. You can also follow us on social media at Seaview Ortho on Facebook, Instagram, TikTok, and we are on LinkedIn. We also have a podcast called the Seaview Ortho Podcast. It is available on Apple, Spotify, Amazon, pretty much anywhere you could listen to a podcast. And we actually have a new episode featuring Dr. Scura that comes out tomorrow. So go to your favorite podcast platform and get ready for that in the morning. And don't forget to sign up for our newsletter as well. So once again, this was recorded. You will receive the link probably in the morning to your email. Just keep an eye out for that. And we do encourage sending the link to friends and family and anyone who may have missed out. So thank you again to Dr. Scura for sharing your time and your knowledge. And to all those who logged in tonight, hope everyone enjoys the rest of their evening.
Thanks so much, everybody. Thanks for joining. Hope you learned something.